Hi, so we're going to continue on talking about acyanotic heart defects. Keep in mind, acyanotic heart defects uh, are conditions that don't cause blueness. And we know what acyanotic means, which just means to turn blue like a smurf. Um, but um, all acyanotic heart defects have four things in common. They have regular mucous membranes. That means they have their O2 levels are normal. However, they have abnormal circulation, and the blood is oxygenated. Okay, so those are the four things that acyanotic heart defects are. This is acyanotic heart defects part two, and I'm going to get started. So, patent ductus arteriosus. So, what is patent ductus arteriosus? A PDA in the womb, there is, when the baby's still in the womb, you have this opening in between your aorta and your pulmonary artery, okay? When the baby comes out, it usually closes on its own. However, if the baby is premature, it's not going to close. So what it is that you have basically a hole between your aorta and your pulmonary artery. Okay. Now, usually, most of the time, the children who get this are most likely premature babies. Okay. Um, so let's think about the side effects. So if your aorta is pounding all this blood pressure to to the organs, but you have the oxygenated blood is mixing in the pulmonary artery, what's going to happen to the pulse pressure, right? So one of the side effects is that the pulse pressure is going to get wide, and your diastolic is going to be low. And when you think about this, it's only because I had to take a minute and think about this too. And hopefully I may be right. Who knows, but it makes sense to me. So if all the oxygenated blood that's pumping from your left ventricle is trying to get to your aorta, and some of it mixes with your pulmonary artery, and your pulmonary artery is supposed to go to your lungs and reoxygenate that blood, uh, you're pumping probably 50, 30 to 50% of the blood that's supposed to perfuse to the organs and back to the lungs. So what's happening is that you're not perfusing as much as you should to your extremities. So when they take the baby's blood pressure, they're going to notice that the return value is low because it's not pumping everything back to do the capillary exchange to pump it back up. You know what I'm talking about? You know what I'm saying? Now, with this too, in regards to this and perfusion with the diastolic blood pressure being low, the capillary refill time is going to be prolonged. So prolonged. Now, did I miss anything with that? I feel like I'm missing stuff. No. Okay, cool. Another thing that can cause this is high altitude. I think it's just because the demand on the heart, the higher you go. But remember, the main causes are prematurity and high altitude. It's asymptomatic, and but this can too also lead to heart failure. But the treatment. So what's the treatment? So the first treatment they're going to try is non-pharmacological. It's called endomethacin. Endomethacin is, I think, ibuprofen in it too. It will actually work to constrict and close that PDA. Okay, and this is given IV, not PO. That's the route they give it. It constricts that tissue so it closes. Um, That's the first thing they want to do first is not non-pharmacological. Why I say that? Non-surgical, a non-surgical intervention first. The less invasive intervention. The next thing they're going to do is a cardiac cath. Like I said, cardiac calves. They're mostly used for every single last one of these. Okay, cardiac calves can be used to repair or diagnose a type of heart condition. Now, in regards to make sure it's right. This prostaglandin, because that's what it is. This is for premature babies only. If the child is full term and they have a PDA, this will not work. Okay, probably gonna have to go and cap it. I don't know why, but it just doesn't work for. It just doesn't work for. Okay, sorry about that. So so the treatment for a PDA is going to be a cardiac cath. Now, there's a few ways they can do this cardiac cath. It can be a little coil, which is really cool, which I recommend you Google and look up, or a patch. So the interesting thing about this one, this is why this is my favorite one, is that this one uses the coil. And what the coil does is that it's like a little thing that they use is like little bitty tiny, and they put it in there, and tissue starts to grow around it. And then if tissue starts to grow around it, it cuts it off. So I thought that was pretty cool. I watched a video on it. It's pretty cool. I probably will never do it because I don't want to perform heart surgery ever. Um, but is that all that I got? Yes. Now, with PDA too, keep in mind, this is purple blood. It's a mixture between oxygenated blood and deoxygenated blood. So you just want to keep that in mind because it's allowing oxygenated blood to go back to the lungs too. And my last one is this one is pretty cool. The last one is core. I can't ever pronounce them. I'm sorry. Choriation of the aorta, which I have to erase off my board, and then we're gonna get started. Bye.